goodness.
Number 61. You respond to a residence for a 40-year-old female who was assaulted by her husband. The scene has been secured by law enforcement. Upon your arrival, you find the patient lying supine on the floor in the kitchen. She is semi-conscious with severely labored breathing. Further assessment reveals a large bruise to the left anterior chest, jugular venous distension, and unilaterally absent breath sounds. As your partner is supporting her ventilations, what should you do? A. Insert an OPA. B. Obtain a set of baseline vital signs. C. Perform a detailed physical exam. Or D. Immediately request ALS support. So your patient is semi-conscious, severely labored breathing, and also unilaterally absent breath sounds. She also has a large bruise to her left anterior chest and JVD. Just a guess, what might you think could be wrong with this patient? Okay, so pneumothorax, potentially. What else? Because that JVD, that's a good thought. Anything else y'all can think of? Yeah, it's possibly internal bleeding, myocardial contusion, all kinds of things. You don't really know, but something is clearly wrong. She's semi-conscious. Those unilaterally absent breath sounds are really concerning because that's very atypical. For a pneumothorax, you'd usually think it'd be one or the other, but the fact that you really don't hear any breath sounds at all is a problem. I mean, all of this is a problem. Based on this, you'd actually want to go ahead and get ALS support immediately. Because there is so much wrong with her, that it's not something you can easily treat or even start. You can start to come up with things that might have caused the problem, but you're not going to reach a full diagnosis. Because of those unilaterally absent breath sounds and also that large bruise on the left anterior chest and the JVD, you're expecting that there's major cardiac and respiratory problems, so you'd want to get that ALS support right away. Number 62. A 39-year-old female experienced a severe closed head injury. She is unconscious with her eyes slightly open. Her pupils are bilaterally dilated and slow to react. In addition to managing problems with airway, breathing, and circulation, what should you do? A. Close her eyes and cover them with a moist dressing. B. Secure her eyes open so you can reassess her pupils. C. Inspect her eyes and gently remove impaled objects. Or D. Irrigate her eyes with water to prevent mucosal drying. A is the best answer. Close her eyes and cover them with a moist dressing. You don't want your patient's eyes to be open for an excessively long amount of time. It can cause major damage to them, actually, if they're open, because the mucus is so important. Irrigating with water wouldn't be sufficient, and you certainly don't want to secure her eyes open. You're going to make her go blind. So the best choice is A. Remember, C, we don't ever remove impaled objects. We don't use tweezers or anything to pick stuff out. The only time we ever really mess with that sort of thing, we can rinse out somebody's eyes with sterile saline if there's particles and they're complaining of pain. You can rinse them out. Otherwise, you really don't ever try to remove something that is stuck in a person's body. 63. Your unit has been dispatched to stand by at the scene of a structure fire. There are no injuries that you're aware of. Upon arriving at the scene, you should A. Contact medical control and apprise him or her of the situation. B. Park your ambulance behind the incident commander's vehicle. C. Set up a staging area where firefighters can be treated if necessary. Or D. Ask the incident commander where the ambulance should be parked. D is the correct answer here, just based on logic. You don't need to contact medical control because they're not in charge of this situation. They dictate what you do as far as actual patient care, at least they're the ones that authorize it, but that incident commander is going to be the one that's in charge of your actions at that specific scene. So it makes sense to just ask him what you should do at that point. Number 64. Your unit is the first to arrive at the scene of a large tanker truck that has overturned. The patient is still inside the vehicle and is screaming in pain. You note that a green liquid is leaking from the tank. You should A. Don BSI equipment and rapidly extricate the patient. B, remain at a safe distance and notify the hazardous materials team. C, ask the patient if he can free himself and come to you. Or D, immediately request law enforcement for traffic control. B. Did we have this question once before?
It was something like
It was
that.
very similar.
The gas.
Yeah. So we talked about what you would do as far as like gaining information or gathering information to tell the hazardous materials team with the placards and stuff that you might see on the truck. But yeah, you remain at a safe distance. I mean, we've had enough questions like this. Y'all know what to do. 65. A 4-year-old female has a peanut lodged in the external auditory canal of her right ear. You should A, use tweezers to try to remove the object. B, remove the peanut with a cotton tip swab. C, transport her to the emergency department. Or D, thoroughly flush her ear with sterile saline. C. Remember, we don't remove things. I earlier said you just would flush the eyes if there's potentially like particles in the eyes. The only other time I can think of that you'd want to remove something is if a person was impaled or stabbed somehow and it impeded airway and breathing efforts. Otherwise, you pretty much leave everything the way it is. It's not your job to like remove objects. So C is the best answer. You just transport her. 66. A 20-year-old male was accidentally shot in the right upper abdominal quadrant with an arrow during an archery contest. Prior to your arrival, the patient removed the arrow. Your assessment reveals that he is conscious and alert with stable vital signs. The entrance wound is bleeding minimally and appears to be superficial. You should A, transport only if signs of shock begin to develop. B, carefully probe the wound to determine its depth. C, assume that the arrow injured an internal organ. Or D, clean the wound and apply a dry, sterile dressing. So clearly not A, because we don't only transport in this only of signs of shock. Remember, you transport regardless. If there's an option that says don't transport or maybe don't transport, it's not going to be the right answer. B is out because we don't go poking in somebody's wound to find out more information ever. So between C and D, the answer here that you're supposed to choose is C. Assume that the arrow injured an internal organ. So even though it appears to be superficial from the outside, this is one of those cases where we're supposed to just assume the worst case scenario so we can treat for that. Better to assume the worst case than assume that it's not that and somehow it actually turns out to be a whole lot worse than you think. That's why when you have a patient who's unconscious and nobody saw them fall or nobody saw how they ended up to be unconscious, you automatically assume there might be a spinal issue because you don't know any better about that patient. And you don't want to assume that they just lay down for a nap or something. You want to assume that there's a problem, even if you're not sure. And so that's the same principle we apply here. You're going to assume that it injured something that you just can't see yet, and act off of that. Also, why is D less? What do we normally do as far as abdominal wounds in terms of dressings? We usually do moist. It would kind of depend on the wound. In this case, I would probably still do dry, at least for covering everything up, because that's how you deal with bleeding. But typically for abdomen, I think that's why it says dry, because typically for abdominal wounds, we talk about using a moist dressing for all those internal organs and everything that's in there. At any rate, C is the best answer here. 67. You have applied a dressing and roller gauze bandage to the arm of a young female after she lacerated it when she fell from her bike. During transport, she begins to complain of numbness and tingling in her hand. You should A, remove the bandage and dressing and apply another one. B, carefully manipulate her arm until the symptoms subside. C, assess distal circulation and readjust the bandage as needed. Or D, remove the gauze bandage and replace it with an elastic one. C, definitely. That's why you have to be constantly reassessing your PMS or your CMS as you go along during transport, just to make sure that they still have. Remember, you reassess CMS, you reassess your ABCs. Basically, you redo your primary assessment. Check for all the important stuff, level of consciousness, airway, things like that. 68. What layer of the skin forms a watertight protective seal for the body? Is it A, dermis, B, epidermis, C, muscular layer, or D, subcutaneous layer? So to answer this, those are all layers that are, are part of the skin, or at least part of the outer layer of the body, which one is the most external? The most external is the epidermis. That is your layers of, like, what we consider to be skin, the skin cells, essentially. Your dermis is the layer below that. It's full of your nerves, your blood vessels, glands, hair follicles, depending on what type of skin it is, where it is on your body. The dermis contains all of that important stuff. Subcutaneous layer is the fat that is below the dermis, and then your muscles are, of course, below the fat. So which one of these is the most, has the least holes in it, I guess, like the most of an actual seal, would you suspect? The answer is the epidermis. It's the outermost layer. It's the one that does the most protection as far as actually letting things in and out. The dermis has a lot of functions, but protection is not really its main function. Subcutaneous layer is the fat below it, but it's the epidermis way up at the top that actually helps seal stuff out of the body. This is a definition question. So, like I said, you probably won't have a ton of these, but you'd want to at least be aware of stuff, basic anatomy and things you might want to go back over for the test. Number 69. When arriving at the scene of an overturned tractor-trailer rig, you note that a green cloud is being emitted from the crashed vehicle. The driver is still in the truck. He is conscious but bleeding profusely from the head. After notifying the hazardous materials team, you should A. Park downhill from the scene. B. Ask the driver to exit the vehicle. C. Position the ambulance upwind. Or D. Quickly gain access to the patient. C. Remember, upwind means not where the wind is going to be blowing that green cloud at you. Downhill, and obviously you might catch something, liquid or otherwise. So positioning the ambulance upwind, that's essentially BSI type precautions, making sure that you're safe. 70. You arrive at the home of a 50-year-old female with severe epistaxis. As you are treating her, it is most important to recall that A. The patient may be significantly hypertensive. B. The patient is at risk for vomiting and aspiration. C. A detailed exam is needed to determine the cause. Or D. Many medications interfere with blood clotting. What is epistaxis? Anyone remember? It's a nosebleed. You should remember that one. You should remember it from now on, in other words. You might have a question like this on the test. So if somebody has a severe nosebleed, which one of these is the most important thing to remember or to keep in mind? When we talk about the thing that is most important to keep in mind, we're talking about the thing that would make the biggest difference in terms of how you're going to treat and assess this patient. So if we're talking about patient assessment, we're talking about that patient model, right? So if BSI was on here, it'd be most important to recall that you should be wearing gloves. That's the kind of thing that we should be looking at. Based off that order that we know as far as patient assessment, which one of these relates first to an item on your patient assessment? B. The patient is at risk for vomiting and aspiration. Why is that one the highest ranked? Because it deals with airway and breathing. And airway and breathing are right up there at the top, one of the very, very, very first things you deal with. The patient may be significantly hypertensive. We don't know why she has a nosebleed. It's possible. You can have nosebleeds caused by hypertension, so that could be a thing. But it's not more important than remembering that she might have airway complications because of her nosebleed.
Would that be like next to the demonstration?
Potentially. It's not a treatment thing, so maybe not. Like, you can't treat her hypertension. The only things you can do are things relating to like chest pain that are also associated with hypertension. And you wouldn't give nitro because she has a nosebleed or something. That wouldn't fit. Many medications interfere with blood clotting. That's more like information that you should ask at some point, just like hypertension is more like something that you should know. But really the only one of these that deals mostly with treating is that vomiting and aspiration one. If they had an answer choice on here that, because she has a severe nosebleed, maybe they would have an answer choice where it is most important to recall that your patient may begin to experience signs and symptoms of hypoperfusion. which would mean she's going into shock because she's lost so much blood. That would be something to keep in mind because that is a circulation thing that you could treat. Does that make sense? Like the difference between the circulation thing you can treat and just a condition relating to circulation. Talking about her hypertension is more almost talking about like past pertinent history because it's talking about the cause of it, not something that you can actually do to help that patient right now. 71. This isn't a good question. Most terrorist attacks, A, are carried out by less than 3 people. B, occur within the continental United States. C, involve the use of nuclear explosive devices. Or D, require multiple terrorists working together. The answer is D. We're not really going to talk about this one because it's not a good question. I'm just giving you the answer so you know it. Number 72. You are dispatched to the scene of a building explosion. Upon arrival, you see people frantically fleeing the building, screaming, "Everyone is passing out." You should A, carefully assess the situation and ensure your own safety. B, assist with the evacuation and begin triaging the patients. C, notify dispatch and state that a terrorist attack has occurred. Or D, contact the FBI immediately and report the current situation. A, yes, remember, when in doubt, anything that talks about your own safety is probably the very first thing you should do. Even though these questions don't say first or immediate, that's what they're talking about. C and D are completely unacceptable. You don't assume that it's a terrorist attack. You can talk about that you might need to call in hazmat, or you might need to call, law enforcement or something, depending on the actual situation. But you don't know that it's a terrorist attack, and you certainly do not have a direct line to the FBI. So neither one of those makes any sense. 73, actually we're not going to talk about 73. It's another one of those intubation process questions that just don't apply to y'all. 74. A young female experienced a laceration to her left eyeball from flying glass when her boyfriend broke a soda bottle against a wall. There is moderate bleeding, and the patient states that she cannot see out of the injured eye. You should A, carefully examine her eye and remove any foreign objects if needed. B, avoid applying pressure to the globe when you are covering the eye. C, ask her to move the injured eye to assess the integrity of the optic nerve. Or B, apply firm, direct pressure to the injured eye and cover the opposite eye. Say it louder. B, yes. When it says to the globe, it's talking about just essentially to the eye, the sphere. Avoid applying pressure directly to the eyeball and cover the eye. You want to cover both eyes, remember. You would not want to just cover one because generally speaking your eyes move in tandem, and just because this one's closed doesn't mean it's not moving whenever this one is. So you want to make sure you cover both because if she's distracted and this eye is still seeing things, this eyeball is also going to be moving around and causing her pain. You don't want to make her to move her eyes at all, generally speaking, because that's only going to make the lacerations or the pain worse. So you cover both eyes. Okay, 75. A 40-year-old male presents with severe abdominal pain following blunt trauma. He is diaphoretic, thirsty, and has a weak, rapid pulse. Appropriate treatment for this patient includes all of the following except A, covering him with a warm blanket, B, giving him small sips of plain water, C, promptly transporting to the hospital, or D, administering supplemental oxygen. B, yeah, everything else is fits within the standard of care for shock, which makes sense in this case. He has a weak, rapid pulse, diaphoretic, and he had blunt trauma to the abdomen, so shock is really likely. You never give a patient small sips of water, regardless of what's going on with them. The only thing that comes close is when you're talking about a patient who's hyperthermic and you are trying to cool them down. You would probably give them something to drink, depending on the patient, but typically that's not something that we would talk about as far as like the National Registry testing standard of care. 76. A 45-year-old male presents with severe vomiting and diarrhea of 3 days' duration. He is confused, diaphoretic, and has a weak and rapid radial pulse. His blood pressure is 88/50. After applying 100% supplemental oxygen, you should A, perform a head-to-toe assessment, B, allow him to drink plain water, C, obtain a repeat blood pressure in 5 minutes, Or D, prepare for immediate transport? D, yeah. D is what makes the best sense. We know that B is wrong. We already talked about that. Obtaining a repeat blood pressure in 5 minutes, that's typically what we would do if we'd done any sort of intervention to change his blood pressure. But that doesn't make sense at this point because you haven't done anything. You can't do anything to change someone's blood pressure and raise it. So you want to go ahead and transport because essentially what you're trying to do is he's got dehydration, which is also leading to hypovolemic shock. In other words, the volume of blood in his body is too low, so he's going into shock. That's why he has such a low blood pressure. So you want to transport immediately because you can't fix that out in the field. 77. A 13-year-old child is on a home ventilator. The parents called because the ventilator is malfunctioning. You should A, attempt to troubleshoot the ventilator problem. B, discontinue the ventilator and ventilate with a BVM device. C, place a call to the home health agency treating this patient. Or D, reset the ventilator by unplugging it for 30 to 60 seconds. This is straight from the book. Say it louder. B. B is the correct answer. Yeah, when you've got a patient who is on a ventilator and it's not working, it's not your job to try to fix the ventilator or figure out why it's not working. You just provide the ventilations for them. 78. During your assessment of a patient who is shot in the abdomen, you notice a large entrance wound with multiple small puncture wounds surrounding it. This wound pattern is most consistent with A, handgun, B, shotgun, C, .22 caliber pistol, or D, .357 Magnum. B, a shotgun. I don't know that I would necessarily expect this to be the kind of question you would see. However, they might ask questions about weapons. Remember, there's different levels of weapons based on how they're delivered, how they actually affect the body, and the damage they cause. So we have low velocity, medium velocity, and high velocity weapons. What would be an example of a low velocity weapon, if y'all think?
Would be a handgun.
Like a knife would be a good example. Anything that is delivered by hand. So at the speed of how your arm moves, whether that's a knife, knife is probably the general term, but anything that could puncture or impale or be held, an arrow if you're holding it in your hand, something like that. Even an arrow that is shot from a bow is relatively low velocity. It's not super fast, not compared to guns, which fill up the other two categories. So a low velocity weapon would probably just leave the actual path of damage that it creates inside the body. That is to say, you stab a knife in, and wherever the actual edges of the knife cut, that is the wound pattern that's left inside. Medium and high velocity weapons leave more of a wound pattern inside. So a medium velocity weapon would be like a handgun or a shotgun. High velocity would be some sort of high-powered rifle, assault rifle of some sort. And yeah, for those, they don't just have the path that the bullet takes, which remember, the path that a bullet can take inside the body is very unpredictable. They don't just go straight and stop at something. They can find, the hollow places in the body. They can follow a blood vessel up somebody's arm, under the skin. That's why you hear stories of people getting shot in the head and it doesn't actually enter the brain because it enters into the skull, but the small amount of space around the brain is slightly easier for that bullet to go into than the brain itself. And they're unpredictable. It'll arc all the way around the skull and come out on the other side. They've seen stuff like that before. So bullets, the path is unpredictable. That's why you always look for an entrance and an exit wound in any patient. But beyond the path, you also have what's called the cavitation, which that's essentially the extra amount of damage caused by usually the shockwave of the bullet entering. Everything else because it's not just a bullet, it's all the air and everything else that comes out of the gun. And it, you can watch videos of it with ballistics gel, Mythbusters do this all the time, how they shoot in and you can see kind of the path expand and then it sort of closes back behind the bullet. However, it has ripped open and has expanded and is still damaged even if it doesn't look as open anymore. Does that make sense? So you want to be careful with those and make sure you understand the difference between medium, high, and low velocity weapons. 79. As the first arriving emergency responder at the scene of a suspected terrorist or WMD incident, you should request additional resources as needed, and then A, remain where you are until additional ambulances arrive at the scene. B, function as the incident commander until additional personnel arrive. C, direct your partner to begin triaging patients as you call medical control. Or D, carefully inspect the area for the presence of secondary explosive devices. Which one is absolutely incorrect? D is definitely wrong. We know that we are not involved in trying to ever clear a space or evacuate people or anything like that. The best answer in this case is B, function as the incident commander. For something like this, where it is going to follow that incident command system that we've kind of talked about, the highest ranking person who is first on scene. So if it was like you and a paramedic in an ambulance, the paramedic would be the incident commander because they have more knowledge. So they're slightly better equipped to handle something. If it's you and another basic, then one of y'all would be, kind of depending on maybe who had the most seniority or experience or something. In this case, we're assuming that you're the most capable person in that ambulance. And so you'd be the incident commander until more people came who were actually capable of really handling it. Because you're not expected to do it for long. It's just that idea of like, once you start using the system, there's going to be an unbroken chain of who is in charge. Even if it's you for like 2 minutes, you still are technically in charge for 2 minutes between you and your partner, getting set up or something. Okay. 80. You are dispatched to a convenience store where the clerk sustained a laceration to his neck during a robbery attempt. During your assessment, you note bright red blood spurting from the laceration. What should you do? A, apply direct pressure below the lacerated vessel. B, circumferentially wrap a dressing around his neck. C, apply pressure to the closest arterial pressure point. Or B, apply direct pressure above and below the wound. So, when you have this wound, laceration on the neck, bright red blood spurting means what? Arterial bleed, yes. How do we typically deal with arterial bleeds? Yeah, like with any other bleed, you do direct pressure. It's always the way that you would start. Now, the one, difference here is that it is a laceration to his neck. So what do we want to be concerned with when we're dealing with a neck injury? Yeah, obviously you can't completely close off everything. So wrapping a dressing circumferentially around his neck is not the way you'd go. You're never supposed to put something all the way around like that because he still has to be able to breathe. He still has to be able to have some blood pass through. That's not going to fix the problem. You need some sort of pressure, right? The other three options all have applying pressure somewhere. What is the other consideration when we have a neck injury? Not just that blood has to get up to the brain. Yes. But still, that's a circulation thing. Like, besides circulation, or rather besides blood getting up to the brain, what is a prime concern? Yeah, you're not wrong. I'll just go ahead and give you the answer I'm thinking of. You really want to be concerned that you don't get an air embolism. So if you have a wound in the neck, and it's open and it's bleeding, there's always a chance that a little bit of air could go inside. There's a little tiny bubble, go up, get lodged in one of the brain blood vessels, and cause a stroke or something worse to happen. You don't want to allow an air embolism to get inside like that. So that's why with a neck wound, you have to be very, very careful that you don't impede blood flow, but you also don't just, let it freely be open or something. The best answer here, because of those two considerations, is going to be D. So if you apply direct pressure above the wound, that means you're putting pressure so that air can't slip into that blood vessel that is above the wound. Okay? If you're applying direct pressure below the wound, that means you're putting pressure on the actual bleed. Does that make sense? Because it's an artery and it's carrying blood up the neck, you want to apply it above so that you stop that bubble from potentially getting up, but you also want to apply it below to actually stop the bleeding. That's the best way. And obviously there's still going to be bleeding out. You can't completely control everything, but that's the best way to try to deal with this. A, applying direct direct pressure below the lacerated vessel doesn't allow for that concern of the air embolism. That's why it's not as good. And C, applying pressure to the closest arterial pressure point. For one thing, we don't actually teach pressure points, I don't think, as an EMT anymore. I know they used to, but I don't think they do. And also, that would be, like, the idea of that is to completely close off that artery, which would be a problem since it's what's carrying blood up to your brain. So it's really not the best option. D is the best option.